As a urologist, I prescribe drugs to patients every day. As a sexologist, I know that some of them can impact the sex lives of my patients quite dramatically. For the worse, but also for the better, believe it or not. In this video, I am going to present to you surprising side effects of 6 common drugs, and although this may sound odd, I use some of these side effects to make the sex lives of my patients better. Curious? Then watch this video to find out more. By the way, did you know that this video has side effects too? Actually, it makes 80% of the viewers subscribe, and it increases the urge to hit the like button and start binge-watching videos on UroChannel. For the sake of science, if this is the case with you, let me know in the comments below. Drug number 1 is one of the favorite drugs prescribed in urology. Tamsulosin is a selective alpha blocker for increasing urinary flow in benign prostatic obstruction. I like this drug because it is highly selective and doesn't affect blood pressure as much as non-selective alpha blockers. In cases of pelvic floor overactivity, it is the secret weapon to reduce these enigmatic urgencies. Unfortunately, this effect is observed in only a small percentage of patients, but still, if it proves effective, the results can be remarkable. However, if you care about semen volume or want to have kids, this drug holds an unpleasant surprise. In many men, it reduces the amount of seminal fluid quite dramatically. It is not a retrograde ejaculation where the ejaculate goes right into the bladder. The seminal fluid just isn't expelled, and possibly there is also a reduction in seminal fluid production. All of this is fully reversible, so if you stop taking the drug, everything will be back to normal. Let's move to number 2, which is PDE5 inhibitors like Viagra and Cialis. Viagra was not intended for erectile enhancement. It was originally designed for cardiovascular purposes. It eventually turned out to have a remarkable side effect. It enhanced and sustained erections. So, in a sense, using Viagra for erectile dysfunction is making use of the side effect of a drug for the heart. Viagra and Cialis don't have any effects on sexual desire, and they don't cause automatic erections, just in case you weren't aware of that. Drug number 3 is Finasteride and Dutasteride. They are so-called 5-alpha reductase inhibitors and block the conversion from testosterone to dihydrotestosterone. This has a shrinking effect upon an enlarged prostate. I don't prescribe them very often, but they are a good choice for the elderly patient with a substantial symptomatic prostatic enlargement, not willing to undergo surgery, and where the enlargement is reflected in the individual PSA value. These drugs can potentially lead to erectile dysfunction, decreased libido, or reduced semen volume. However, these effects are probably overestimated due to reports about irreversible erectile dysfunction after cessation of these drugs, which has been named post-finasteride syndrome. After these reports, the number of patients reporting these symptoms nearly quadrupled. We are still lacking good quality evidence to support such a side effect, and even if post-finasteride syndrome doesn't occur very often, I think one has to be cautious with these drugs nevertheless. Finasteride is approved for male pattern hair loss as well. My personal opinion is that the only moderate effect on balding doesn't justify the risk of possible side effects, especially because the drug is mostly used by young men for this purpose. So as a rule, I counsel my patients against it regarding its use against hair loss. The 4th class of drugs which is important is the so-called Selective Serotonin Reuptake Inhibitors, SSRI. They are widely used for the management of depression, anxiety disorders, chronic pain, and much more. SSRIs can have an impact on sexuality with erectile dysfunction, decreased sexual desire, and orgasmic disturbances. As for the severity of these side effects, there are differences between the individual substances. But it's not all bad. Actually, I make use of one of those side effects for therapeutic purposes. I am talking about lifelong premature ejaculation. For more information about this condition, please watch this video. Duloxetine is an SSRI that is approved for lifelong PE. Low-dose paroxetine as an off-label drug is very effective against lifelong PE, so after all, side effects may be helpful in certain situations. It goes without saying that this side effect can become very problematic in a man with a normal ejaculatory function who is on these drugs for like depression, because it may result in the inability to ejaculate. Drug number 5 is beta blockers. They are used for high blood pressure and they block, well, beta receptors. Problem is, you need these receptors in your penis for erections. If they are blocked, then you get erectile dysfunction. Sometimes it is possible to use some other class of drugs instead, which doesn't affect erectile function. Or it may be possible to change to nebivolol, which is the only beta blocker that protects the erection. Drug number 6 is dopamine agonists. They are mostly used for Parkinson's disease, but if you suffer from restless leg syndrome, you may have a prescription as well. One has to be aware of that dopamine agonists have 2 severe side effects. One of them is hypersexuality. Sexual desire may be amplified to a point where all inhibitions fall. While it may initially sound amusing, just think about it for a second. This is a severe side effect that can easily get you into conflict with the law because it leads to sexual harassment of other people and even prostitution. I don't know if this is true, but I once learned on one of my training courses in sexual medicine that this is a side effect which primarily is seen in Europeans. I know that many of you are watching from the US. At this class, they told us that North Americans have a tendency to develop the other severe side effect. This side effect is pathologic gambling. I have no clue why this may be the case, but it's a severe thing as well, that's for sure. By now, I believe you understand that prescribing drugs can be tricky business. Sometimes, however, there is no choice because the burden and dangers of a given disease outweigh possible side effects by far. One has to keep that in mind. Thanks for watching. Bye-bye.